I'm Dr. Jelena Radosavljevic. I'm a principal doctor at the CBD Doctors Melbourne. We are a family business, small practice with 7 GPs that has been established 5.5 years ago. 70% of our patients are people that work or live or both in the city, and 30% of our patients are people that are travelers. We have got a variety of skills among 7 of us. We have done that over the last 5.5 years, and COVID-19 pandemic has actually disturbed that a bit because we are in the epicenter of corona pandemic. We started very early, probably late January, around 20th or 25th of January, where borders were closed for Chinese nationals or people traveling from China. We suspected that it was going to affect us heavily, so we planned for pandemic. It started with one of the doctors asking for masks, and we started investigating and researching. And we had a pandemic plan sometimes at the end of January. Pandemic plan that's actually published by Royal Australian College of GPs. We basically tailored it towards our needs because we knew that if this was to be a pandemic, we knew that it was going to affect our practice, our patients and our doctors quite heavily. So we ordered masks and we ordered gowns, and very short after that we had gowns and masks delivered. And ever since then we had support from Primary Health Network that provided masks on a regular basis. During this time we had another delivery of gowns, which was probably beginning of March, and we are still fine. We had to tailor our practice at least 3 times. At the beginning, we established an isolation room where all patients with respiratory symptoms would go. We had posters at the bottom of the building in the lift because we were on 10th floor. We had posters and asking patients to report to the reception if they've got any symptoms. So that phase was basically I would describe as a patient and receptionist driven, where receptionists would give masks to patients and escort them to the isolation room. Doctors would come completely gowned up with a mask and they would examine patients, order tests, and patient would go straight away from that isolation room home without paying, without any contacts in waiting area. That was the first phase. As the time progressed, everything was changing so quickly. We had lots of guidelines, first of all from the federal government at the beginning, then we followed guidelines from the Victorian government, and then College of GPs, but rules changed sometimes 3 times a day. We had to change our website a few times. We had to change our messages on booking engines, and it was really very fast. And I have to say that it was important that all doctors were involved, and doctors were basically making decisions what was going to change and what needed to be done in order to basically prevent infection from spreading. We had a WhatsApp group where we basically shared information a few times a day, even on weekends. And it was really difficult for everyone on Monday morning to come and realize that things have changed already. And I had to send emails to everyone on Sunday night or Monday morning to say this is what we're doing from today. Then a few days later we did the same thing. And thanks to more senior doctors like me, who basically had been involved in SARS a few years ago, we had experience and we had sort of capacity to deal with this. So that was basically the baseline. Second phase came where a majority of businesses in the city closed their doors. Lots of workers were sent home. to work from home. There was a pressure to basically find out what we were doing, how we were doing, whether we were safe to stay, whether businesses were safe. This is what I do for a living. I'm a GP, I'm a doctor, and I'm proud to be able to support pandemic in the way that everyone was expecting me to do. And I think this is my privilege and this is my pride that I could do something for this society. Of course, I had gowns and I had masks at that time, and I wasn't fearful of my own life. At that point of time, we had a couple of businesses coming to see the premises and see how safe premises are to accept people with corona, and they were happy. So as the last man standing in the building, I was very proud to stay. Then at that phase, instead of basically sort of being concerned about the business and without concerns from other businesses, we were given the opportunity to basically progress in pandemic and test people and not let them to come to the premises to make other people safe, other patients and our staff safe. So the manager of the building was kind enough to give us the access to the premises that are currently not used, so we could actually examine patients downstairs, so that patients with symptoms that needed to be examined wouldn't come upstairs. So we decided to change our protocols. So we decided to, because GPs were given the opportunity to test people for coronavirus, we had two streams. Patients would call the practice and they would book telehealth, teleconference with a doctor. Doctor would take proper history and make a plan for management, and then people were streamlined into two categories. One that only needed to be tested and the other one that needed to be examined and tested. So we decided that people that needed to be tested could be tested outside of the building, just short drive-through clinic or short walk-through clinic. And the other group would be basically taken inside, would be examined and would be tested. So that was the second phase of the pandemic at CBD Doctors Melbourne. We had few people, a few of our staff and few doctors complaining of some symptoms that would be consistent with upper respiratory tract illness, but we tested them all, so they were supposed to come to stay at home. We tested them. Doctors had a kit at home, so if doctor has a temperature or gets a sore throat or coughs in the morning or at night, they would self-test and they would send the test specimen to the laboratory without actually hesitation. We had a couple of staff members complaining about it, and we had them tested and sent home. So we have entered the third phase. We have actually entered recently a phase where the criteria for testing loosened up, and we are testing everyone even with mild symptoms, particularly patients that work in aged care and hospitals. We asked everyone to download a CodeSafe app, and we asked everyone to follow guidelines by the government. We are testing people to basically contribute to the decision on changing lockdown rules and to be able to get back to normal lives, because Victorians have done pretty well over the last couple of months. We are all looking forward to getting back to normal again.